Surprising household habits can worsen prostate health. Did you know that 1 in 9 men will be diagnosed with prostate cancer in their lifetime? That's a staggering statistic, and it highlights just how important it is for men, especially those over 45, to be proactive about their prostate health. In this video, we're going to dive deep into some common household habits that could be unknowingly putting your prostate at risk. We'll uncover the science behind these habits and provide you with practical tips to make healthier choices. But before we start, please subscribe to our channel to help us continue producing content about men's health. Here on the Health is Natural channel, we believe that health is our natural state, and through natural methods we can regain that state. Let's talk about some common issues men face when it comes to prostate health. The prostate is a small gland located just below the bladder and in front of the rectum. It plays a crucial role in male reproductive health by producing seminal fluid, which nourishes and transports sperm. However, as men age, the prostate can become a source of various health problems. One of the most prevalent issues is benign prostatic hyperplasia, or BPH, which is simply an enlarged prostate. This condition is quite common, especially in older men. In fact, by the age of 60, about half of men will have some signs of BPH, and by age 85, the number rises to 90%. As the prostate gets bigger, it can squeeze the urethra, leading to uncomfortable urinary symptoms like difficulty starting a stream, weak flow, and the feeling that the bladder isn't completely empty. This can be particularly bothersome and can significantly impact a man's quality of life. Frequent urination, especially at night, is another common symptom. This can disrupt sleep and lead to fatigue and other health issues. It's important to note that while BPH is not cancerous, it can still cause significant discomfort and complications if left untreated. Another concern is prostatitis, which is inflammation of the prostate. Prostatitis can be acute or chronic and can affect men of all ages. Acute prostatitis is often caused by a bacterial infection and can come on suddenly with severe symptoms. This can lead to pain in the pelvic area, fever, and flu-like symptoms. Chronic prostatitis, on the other hand, may develop more slowly and can cause ongoing discomfort, pain during urination, and even sexual dysfunction. Now, while prostatitis itself doesn't directly lead to cancer, it's crucial to address it properly to prevent complications. Treatment may involve antibiotics, anti-inflammatory medications, and other therapies to manage symptoms and eliminate the infection. And of course, we can't forget about prostate cancer, which is the most common cancer in men after skin cancer. Prostate cancer can be a serious condition, but the good news is that it is often slow-growing and can be effectively treated if caught early. It often doesn't show symptoms in its early stages, making regular screenings crucial. Early detection through screenings can significantly improve the chances of successful treatment and survival. These screenings usually involve a PSA blood test, which measures the level of prostate-specific antigen in the blood. Elevated PSA levels can be an early indicator of prostate cancer, prompting further investigation. Another important screening method is a digital rectal exam, which helps doctors detect any abnormalities early on. During this exam, the doctor feels the prostate through the rectal wall to check for any irregularities in size, shape, or texture. Remember guys, early detection is key when it comes to prostate health. Regular checkups and being aware of any changes in your urinary or sexual function can make a big difference. So if you experience any unusual symptoms, don't hesitate to reach out to your doctor. Taking proactive steps and seeking medical advice can help you maintain a healthy prostate and overall well-being. You might be surprised to learn that some of the things you do every day, right in your own home, could be contributing to prostate problems. These seemingly harmless habits can have a significant impact on your prostate health over time. Let's start with your diet. A diet high in saturated fats found in red meat and processed foods has been linked to an increased risk of prostate cancer. These foods not only contribute to weight gain, but also increase inflammation in the body, which can exacerbate prostate issues. Incorporating more fruits, vegetables, and whole grains into your diet can help reduce this risk. Foods rich in antioxidants like berries and leafy greens are particularly beneficial for maintaining prostate health. Next up, we have inactivity. Leading a sedentary lifestyle like sitting for long periods can increase your risk of developing BPH and even prostate cancer. Regular physical activity is crucial for overall health and can significantly reduce the risk of prostate problems. Simple changes like taking short walks, stretching, or even standing up periodically during the day can make a big difference. Exercise helps improve blood circulation and reduces inflammation, both of which are essential for a healthy prostate. And then there's stress. We all experience stress, but chronic stress can wreak havoc on your body, including your prostate. It can lead to inflammation and weaken your immune system, making you more susceptible to infections like prostatitis. Finding effective ways to manage stress, such as practicing mindfulness, meditation, or yoga, can help protect your prostate. Additionally, ensuring you get enough sleep and maintaining a healthy work-life balance are crucial steps in managing stress levels. Another surprising culprit is smoking. We all know smoking is bad for us, but it's especially harmful to prostate health. Smoking damages blood vessels and restricts blood flow, which can negatively impact prostate function. Quitting smoking can significantly improve your overall health and reduce the risk of prostate issues. There are many resources available to help you quit, including support groups, medications, and counseling. And finally, let's talk about alcohol consumption. While moderate alcohol intake might not pose a significant risk, excessive drinking has been linked to an increased risk of prostate cancer. Alcohol can also lead to weight gain and liver problems, which indirectly affect prostate health. Limiting your alcohol intake and choosing healthier alternatives like water or herbal teas can help maintain a healthy prostate. Remember, small changes in your daily habits can lead to significant improvements in your overall health and well-being. I want to share a story with you about a patient of mine, John. It's a story that might resonate with many of you, especially those who tend to ignore the subtle signs our bodies give us. John was in his late 50s and had been experiencing frequent nighttime urination for a while. This wasn't just an occasional inconvenience. It was happening almost every night, disrupting his sleep and leaving him exhausted during the day. He brushed it off as just a normal part of aging. Sound familiar? Many of us tend to dismiss these symptoms, thinking they're just part of getting older. But sometimes they can be signs of something more. But when it started affecting his sleep and daily life, he finally decided to see me. It wasn't an easy decision for him. Like many, he was apprehensive about what he might find out. We ran some tests, and it turned out John had an enlarged prostate, or BPH. This is a common condition, especially in older men, but it's not something to be taken lightly. He was hesitant at first when I explained that some simple lifestyle changes could make a big difference. He had his doubts, as many do, about whether such changes could really help. John, like many of us, enjoyed his red meat and wasn't the most active guy. He loved his comfort foods and preferred a sedentary lifestyle, which made the idea of change seem daunting. But he was motivated to feel better. The discomfort and disruption to his life were enough to push him to try something new. So we worked together to adjust his diet, incorporating more fruits, vegetables, and healthy fats. It wasn't about making drastic changes overnight, but rather about making sustainable, healthier choices. We also found ways to sneak in more physical activity into his day, like taking the stairs instead of the elevator and going for short walks in the park. These small steps started to add up. A few months later, John came back for a follow-up appointment, and I could tell he was a changed man. His demeanor was different. He was more upbeat and positive. He was sleeping better, feeling more energetic, and his urinary symptoms had significantly improved. The changes he made had a profound impact on his overall well-being. John's story is a powerful reminder that even small changes can have a big impact on our health. It's about taking control of our lives, making informed choices, and understanding that our daily habits can shape our future. So, if you're experiencing similar symptoms or have been putting off that doctor's visit, take a page from John's book. Listen to your body, make those small changes, and you might just find yourself feeling better than you have in years. Your prostate health toolkit. Let's recap the key takeaways from today's video. We talked about how common household habits can impact your prostate health. Remember, a diet high in saturated fat, lack of exercise, smoking, excessive alcohol consumption, and chronic stress can all contribute to prostate problems. But the good news is, you have the power to make changes. Start by incorporating more fruits, vegetables, and healthy fats into your diet. Aim for at least 30 minutes of moderate intensity exercise most days of the week. And if you smoke, now's the perfect time to quit. Managing stress is crucial too. Find healthy ways to de-stress, like exercise, meditation, or spending time in nature. And when it comes to alcohol, moderation is key. Beyond the basics, superfoods for prostate health. Now I want to go above and beyond and share some bonus tips with you. Let's talk about specific foods that are especially beneficial for prostate health. Think of these as superfoods for your prostate. First on the list is tomatoes. Tomatoes are rich in lycopene, a powerful antioxidant that has been linked to a reduced risk of prostate cancer. Next, we have green tea. Green tea is packed with antioxidants called catechins, which have been shown to inhibit the growth of prostate cancer cells. Fatty fish, like salmon, tuna, and mackerel, are excellent sources of omega-3 fatty acids, which have anti-inflammatory properties and may help protect against prostate cancer. And don't forget about cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts. These veggies contain compounds that help the body detoxify harmful substances, potentially reducing cancer risk. Your health journey starts now. Guys, your health is in your hands. I encourage you to take what you've learned today and start implementing these changes in your own life. Remember, even small steps can make a big difference in the long run. I'd love to hear from you. Share your thoughts in the comments below. Have you experienced any prostate health issues? What steps are you taking to improve your prostate health? And if you found this video helpful, don't forget to give it a thumbs up and subscribe to my channel for more health tips. Also, be sure to check out my other videos on men's health. There's a wealth of information waiting for you. We covered a lot of ground today, from common prostate problems to surprising household habits that can make them worse. Remember, guys, knowledge is power. The more you know about your body and the factors that can impact your health, the better equipped you are to make informed decisions. Don't be afraid to talk to your doctor about any concerns you have. Early detection is key when it comes to prostate health.